For this video lecture, I really wanted to better convey the concepts of HUs. And in order to do that, what I've done is I've pulled up a CT scan of the abdomen and pelvis. That way we have a large amount of different structures to be able to really get a sense of what the corresponding point analysis is for each of these HUs. So when you click on a given point or a given structure, what is that HU? So I'll show you it in point analysis. I'll also show you it in ROI analysis. So basically you get either one given pixel, if you would, or you get one given region to be able to say, all right, here's what these HUs are. So we always have ranges of HUs. So each patient will differ. And each structure will differ. So, for example, the HUs for one section of the liver may differ from the HUs in another section of the liver. So, hopefully by the end of this supplement, you'll get a real solid sense of what these HUs look like. Again, always remember that 0 is the baseline, corresponds to water. So if those densities are more dense than water, it'll have a positive value, or less dense than water, it'll have a negative value. So I think as we go through these ideas, the concepts will really be reiterated quite well. So we'll get started. When we're looking now at the scan, we're at the superior aspect of the scan. So you can visualize the heart here. And you can visualize some of the lungs. So, and then we'll go more and more inferior as we dip down. You can see basically the diaphragm slash liver is being visualized. The spleen is being visualized. The posterior aspects of the lungs are being visualized here as well. And continuing to go down, we can see some of those structures that should be becoming more and more familiar to you based on what you currently know about different structures, where they're located within the body, etc. So the big idea though is that I want to break down some of the HUs associated with a given structure. So I'm going to find a nice slice here. This one is nice because we have the air of the lungs, we have the densities of the bones. You can see here, you can see the spine, you can see that posterior connection, those costovertebral joints. You can see here their ribs as well. We have the solid liver, we have the spleen. We have a portion of the bowels here, the stomach, that's visible as well. So it'll give us a good sense of, hey, what are these HUs corresponding to given structure? So when we look to annotate these, what I'll show you first is a point analysis. So basically when I select a given point, it'll report out an HU. So in terms of predicting things, we know that fat based on an HU table is a negative value. So when I click on here, you can see that that particular area does indeed have a negative HU value, and in this case, negative 111. When we click on other regions of fat here, you can see that they're not all going to be 111. So we have a 122, we have a 119, and so you can see that they're going to differ depending on the location, and that's why ranges are derived for a given structure. So that's kind of the outline contour of the patient to fat. So let's look at the bone though. So looking at the bone, let's click on the spine, and you can see that this is not bright white, so we should expect it's a high HU value, of course. It's much more dense than water. But it may not be as high as some of these other structures. So when we click onto some of these other structures, you can see what they actually look like correspondingly. Look at the difference in the spine once we get towards the spinous process. A little bit more dense bone on this particular region, and you can see that by the given brightness that's associated with that. So as we kind of just go around, you can see some of these different point structures that are associated with bone. So very, very high numbers in comparison to some of these lower numbers. So continuing the concept forward, let's look at some of the lungs. I'm going to kind of drag this around that way, since there's a lot of points that are currently placed, you can be able to see this a little bit better. So you can see about roughly about negative 750 to 800. There are some points that are even lower than 800, of course, that you're seeing, but some that are, I just saw one that was right around in the 600 range as well. So nonetheless, you can see where those points are associated. I'll just throw one down for good measure, so you can be able to visualize that. Negative 808, And then we'll look at one structure point here, almost negative 800 as well within that structure. So what about some of these other structures? We have the big solid liver, for example. Let's throw a point there. You can see basically what that corresponds to. You're seeing a variety of different numbers kind of as we go through, but not nearly the values that we were seeing for bone, for example. So still positive, which you would expect the liver to be positive as well. And when you compare that, the liver structure then to the spleen, you can see relatively consistent, and just purely with pure visualization, you can definitely be able to say, all right, these structures are very, very consistent between the liver and the spleen in terms of their given values. Correspondingly, if you look at the structure of the aorta, descending aorta, look at that, definitely a positive value as well. You can see it's, even though the structure isn't very large, the HU values for each given pixel do differ. Nonetheless, so that's kind of in a nutshell. You can see just on one given slice what this is actually looking like. As we continue to kind of go through, instead of just, one point, we can continue to scan through. We can see different structures that are associated. Just want to go down just a little bit more so you can see some of the differences. You can see the falciform ligament essentially dividing the two lobes of the liver right through this region here. Here you can see the structure of the gallbladder here. And then you also can see the corresponding kidney. This happens to be the left kidney, so anatomically you just remember the liver is on the right, the kidney's on the left, so we can see those structures. So just to kind of go through a few more points here, you can see again what the liver is roughly versus now what are we actually dealing with the gallbladder. And you can see, yeah, there's some negative points in here, there's some positive points in here, but in essence this is just one pixel being analyzed. So I'm just going to throw this back over here just so it's not in the way. In comparison, you can see, I guess, outside of the patient. So air, true air, negative 1,000 is visualized here. But I want to give you a better sense of, all right, what is the gallbladder, for example, actually measuring out as? So when I have an ROI analyzer here, I can actually set a circle and move it. And you can see now we have an average, so we get a better sense of what this is actually looking like. So average HU is 6 HU, so just slightly more dense than water for this region. But we have some positive values and some negative values in here as well. So deviation, standard deviation is indicated there, but nonetheless you can see the average, and that should give you a good sense of what this structure actually is. Just to kind of continue to go down, look at a couple other structures here to reiterate the concepts. You can see a portion of the kidney. I'm going to make this kind of small, that way we're not getting into essentially the KLSC region, since they're a hollow opening in that region, but get a better sense of what that's looking like. So average HUs there. We can get average HUs that are associated with the vertebra. Let's get that out of the way. Let's just kind of go to this region here, just so you can see it a little bit better. You can kind of see as we kind of go around how these values are changing accordingly. And then additionally, as we look at kind of other slices, continuing to go down this patient, you can look at any slice. We can basically get a point analysis for the loops of the bowel. We can see the small intestine versus the large intestine. Continuing to kind of go down, you can see some of the female anatomical structures. Since this is a pelvis, we can see the pelvic bones here associated. So just to get a better visualization of what some of these ROIs are for some of these other bony structures, you can see the differences. So you know that this isn't going to be a crazy high number here in comparison to a brighter structure. You can definitely see the difference. So average over there in the cancellous bone for that particular region was 90, but more of the cortical bone structure that was visualized here, the average was 654. So differences, nonetheless, every patient's going to be different, every point is going to be different, every pixel is going to be different. So structure by structure, there you will see some differences. So in the nutshell, we looked at bone, we looked at air, we looked at fat, we looked at the lung tissues, but you can see some of the female gynecological structures are being visualized here. In the midline of the scan, you can see basically the formation of the obturator foramen right in here, so you can get a good sense of where we're at. Here with the symphysis pubis, ischial tuberosities, you can see basically this is the femur here. And when we're visualizing the femur, you can see, all right, midline, we know that that's the lesser trochanter. So you can be able to visualize the vast amount of structures going into the femoral head and greater trochanters here on the external to that, or lateral to that. So a lot of structures here. Final structure that I'll leave you off with is the bladder. We'll get an ROI of the bladder, so you can kind of see what that looks like there as well. So in this case, you know, an empty bladder versus a full bladder may have carry different HU values as well. So you can see where that point analysis is. And then just to give you an idea of the air within the rectum here, you can kind of see what that point analysis is as well. So, you know, where we were looking at, you know, internal air in this patient is very consistent with basically air that's external to the patient as well, depending on where we're actually looking here. So hopefully you now have a true sense of what these HU values actually look like. We've hit on a variety of different anatomy. I think that's, you know, the abdomen and pelvic structures are great to be able to see so many different structures. And if you have any additional questions about HUs, be sure to let me know. Thanks.